There's just 1 month left to sign up for health insurance through Covered California, the state's version of the Affordable Care Act that requires everyone to have medical insurance coverage. Joining me with information on the tax penalties for the remaining uninsured and how the ACA affects your taxes are my guest, Rafael Tolino with the IRS for Southern California and Nevada, and senior attorney Jack Daly for the Legal Aid Society of San Diego. And Jack, Covered California calls for a penalty. They call the penalty for not having health insurance by this February 15th deadline shared responsibility payment. How come they call it that?
Well, it's the idea that we all share some responsibility in certainly having health care and paying for health care, and assuring that folks have efficient and quality health care. And if we don't all have health care, those things may not be possible.
Are there any exemptions to this?
Certainly. There's a whole list of exemptions on the IRS website and on the tax forms that you will be completing when completing your taxes. But some of the most common ones are short coverage gaps. If you have a short coverage gap of less than 3 months without health care, if you didn't get on health care in 2014 before May 1st, there's an exemption. Or if you had some other general hardship, I think those are the most common exemptions that will come up.
Okay, and there's a link for that on our website,
Absolutely.
kpbs.org, so people can look at that. Now, Rafael, if you're not exempt and you miss this February 15th deadline, what are the tax payments or penalties?
Well, the shared responsibility payment, if you don't have coverage and didn't get coverage and you should have had coverage, is either $95 per adult or half of that per child, $47.50, or 1% of your total household income above the filing threshold, whatever is greater. So for example, if your whole household income was just, say, I don't know, $100,000, so that the filing threshold, let's say your married filing joint is just over $20,000, you take the difference and it's 1% of that as a penalty. So it's either the $95 or $285, which is the cap for the 95, $47.50, or the greater of your household income above the filing threshold.
So it could be $1,000.
It depends on the tax circumstances around the taxpayer.
How does the IRS actually know if you have health insurance or not?
There's a lot of third-party behind-the-scenes sharing per what the law allows us to do accordingly to make sure we administer this accordingly. You're going to get a Form 1095-A from Covered California. If you purchase insurance through the marketplace that shows you the information you need to file an accurate return, chances are you got a premium tax credit in advance, so you'll do a little reconciliation there. But the majority of taxpayers are just going to check a box that says I had health care coverage either through an employer-sponsored plan or a government-sponsored plan such as Medicaid, Medicare, Medi-Cal, and be done with it.
And Jack, let's talk about the tax situation for those people getting government subsidies for their health insurance. What happens then?
Sure. So during 2014, if folks qualified, they were able to purchase health insurance off of the Covered California marketplace with the assistance of either a cost subsidy reduction or a advanced premium tax credit. If it turns out that at the end of the year you received too much tax credit, there will be a reconciliation process through the filing of your taxes for which they will repay that extra tax credit that you received. Conversely, if you receive too little tax credit, you will have that additional tax credit added to your refund.
I see. Now, Rafael, how will the IRS actually enforce, let's say, somebody who says, no, I didn't have health insurance? How will you enforce that? Will you garnish wages?
Well, one, we hope everybody puts accurate return on your taxes like everything else that goes on there. Two, basically your refund will be reduced by the amount of shared responsibility payment that you should have paid based on not having coverage.
And I'll ask this, do you happen to know, Jack, will the penalty increase exponentially each year that you don't have it, or next year particularly?
Yeah, it will increase, not necessarily exponentially. Like for example, in 2014, it was 1% of your household income above the filing threshold. In 2015, it's going to be 2%, and then in 2016, 2.5%. So it will increase over the next several years. I think at some point it will level out. Perhaps in 2017.
Yeah, I don't know the law exactly going forward beyond that, but certainly.
But there is a penalty.
But there is a step increase in the next couple of years.
And it's not too early to file, correct? You're going to start.
Yeah, we're going to start processing returns next Tuesday, January 20th. That's when we'll actually start processing returns, and so get to a computer and get to e-filing, free filing as quickly as you can.
And there's still time. You have till February 15th to sign up for Covered California.
Right, that's
going forward, actually. So for folks that need health care in 2015, that would be the deadline to file your application going forward.
All right. Jack Daly and Rafael Tolino, thank you so much.
Thank you.
Thank you.